crew.
Yes.
All right. Thank you all for joining us on Tuesday, November 10th for our admin meeting. Before we dive in, do we have any public comment on items not on the agenda? Seeing none, our first presenter is Bryce Christians.
Hey, good morning.
Hey, Bryce.
Morning.
So this agenda item is for approval of the bylaws for the newly created Aquatic Invasive Species District. The board has been working through these through the summer and approved them in their October meeting. And so the copy presented is signed by the chair of that board, and we're just requesting your approval.
Great. I love approving bylaws. So.
I was ready for a bylaw comment.
So it's been a while since we've had this privilege and opportunity. So I would move that we approve the newly adopted bylaws of the Missoula County Aquatic Invasive Species District.
Wonderful. All right. All in favor?
Aye.
Aye. Thank you, Bryce.
Thank you.
Let's moving this along.
Yeah. Have a good one.
Thanks. All right. Next up is Matt Jennings, or someone Matt is sending.
Good morning, Commissioners. Brian West. I'll cover this for Matt. We're asking the board to adopt the resolution to appoint the Attorney General's office as a special prosecutor in this matter. The Attorney General's office has a special wing dedicated to offenders who have failed to register, and they are the ones who investigated this particular matter.
Great. I would move that we adopt the resolution.
And all in favor?
Aye.
Thanks.
Thank you.
Brian.
All right, Deb Bell to talk about the Lolo RSID.
I'm not seeing Deb Bell on yet. So could all send her an invite if we could skip her for just a minute?
Jump to the next one. There's Chris.
I am. Good morning, Commissioners. I have the next two items here, and TJ and Rich are on for this one. Josh, while you were away, we had a chance at another meeting to talk about Lexipol, which is software that is designed specifically for law enforcement and detention centers to encapsulate their policies and allows them to do a few things. One is it allows them to send them out to officers for them to review them and for us to capture that they've read those policies with an acknowledgement. So every time there's a change, we're able to capture that change. The officer is able to see it and us to be able to capture that. In addition to that, Lexipol actually develops national best practice model software and policies and provides those then that can be customized to the local jurisdiction. So the Montana Sheriffs and Peace Officers Association and the Montana Association of Counties have been working together to bring Lexipol to the state of Montana for use in detention facilities and by law enforcement agencies. And have worked out a special arrangement whereby the implementation of the software for this year will be CARES Act eligible, and the local jurisdictions will only have to pay a prorated amount for the remainder of this budget year to allow us to have access to that software, both for the detention facility and for officers on patrol. So it's a really good deal, not only for Missoula County, but for the state of Montana. The way Montana Sheriffs and Peace Officers Association and Montana Association of Counties have worked that out is to use several counties around the state as kind of regional hubs, whereby they'll, to make the CARES Act reimbursement process a little bit easier, where they'll do the agreement for that implementation piece. And Missoula is one of those hubs. Yellowstone is one of those hubs. A few of the other counties around the state are basically, and then other counties are kind of hanging off of each of those for the implementation, but has a lot of really great benefits across the county for a really small cost. And again, the implementation this year will be CARES Act eligible. And I'll let Rich and TJ talk a little bit about the specifics of like the benefits they see for their two departments there in detention and patrol and detectives and everything else, but downtown operations and detention.
Great.
Yeah. Hi, everyone. Good morning. It's TJ. Yeah, this is just a great partnership between MACO and MSPOA. It's been in the works for at least a year and a half to bring this product forward to, ensure consistency across the state in policies in regards to state and federal laws, but then also offer best practices to agencies that we can then adapt in a way that fits best to our agency, our county, and in our community. So I've talked to a couple of the sheriffs that already have this policy instituted, and it's very positive remarks. For those working in the field, there's an app on iPhones that are available. There's an app on an MDT. So literally at your fingertips are the latest policies, latest law, state and federal, and then case laws are constantly updated. So it's good information to have and helps our first responders make the best decisions possible out in the field. And then for the detention center as well, as you know, this has kind of been a work in progress to get our staff together to meet monthly to try to get our policies and procedures to make sure that they're up to date with all of this current changes in law and case law that continue to happen. So we fully support it. It's something that we've been looking forward to, and would appreciate the support of the commission as well to make this happen. I think it'll be a great benefit to the county, and having these good policies and procedures in place will greatly, hopefully, also reduce liability for us. So that's
Great.
all I have.
And I will say one last thing. That's a great point, TJ. Erica was very supportive of this as well, and bringing that consistency and availability to make it readily available for officers as well.
So I'm trying to just infer here from it. Basically, this system makes it such that people who are doing work on the ground know exactly what the policies are, and we have evidence that they have read those policies.
Yes.
Can they also use this program to look things up in a pinch if needed?
Yes, they can. As TJ was mentioning, this will be on all the mobile data terminals that are in each car, and they can also install it as an app on their phone. So it'll be really
Great.
handy for those in the field.
Great. All right. Thank you.
Yeah, thanks. This has been a long time in coming, so I would gladly move that we authorize the sheriff to sign the agreement.
All in favor?
Aye.
And I see that
Thank
Deb
you.
jumped on, so if we want to go back, and then I'll do the next one. So
Okay.
Thanks,
All
TJ.
right.
All right. Thank you. Thank you.
Thanks, TJ. All right, Deb, let's talk Lolo.
Yes, thank you. Sorry, I was wrapping up another meeting and I thought I had a bit more time. So yeah, this is our first task order with HDR Engineering. As you recall, last month you guys signed a contract, a 5-year contract with HDR to assist the Lolo RSID with engineering needs, water study, water rights. And so this is our first task order as part of that contract. And what this task order is going to do is it's going to allow HDR to look at our system as a whole, do a water study on it, see where we are failing in water pressure, where we can boost it up. And it's also going to give us our professional engineering report, our PER, for doing the water main extension that we are hoping for down Lewis and Clark / Tyler Lane, so that we can provide adequate water pressure for future growth on that leg of it. And it'll help us build in redundancy to that system so that as we're finding our older pipes failing, we no longer will have to shut off water, 635 homes. We'll have a second source of water where we'll, fixing a break will only in effect maybe 5 or 10 homes. So this is the first step in that long road and that long process of laying the foundation so that we can achieve those goals and making sure that we have adequate water supply and pressure for fire suppression and other needs in Lolo.
Well, that's a good thing.
Yes.
Yeah. Great way to be proactive. I would move that we approve the task order.
Great. All in favor?
Aye.
Thanks, Deb.
Deb.
Thank you. Appreciate it.
Bet. All right, it's back to you, Chris.
sorry, I have to turn the mute back off, otherwise no one can hear me apparently. So the second piece here is a continuation. It's an expansion of the services. As you'll recall, last year, Missoula County began taking applications for positions, a new piece of software from NeoGov. that allowed us to get our what we call an applicant tracking package, which meant the ability for our folks who apply for the paperwork to kind of flow through the entire process. So they get to create one account, and then when there's a new job becomes available that they might be interested in, they can get an email alert. It also allows them to go back through and fill out that job application a little bit easier. And on the back end allows us to process applications a little bit easier when we're filling positions. And that has been a huge benefit this year, as you can imagine, with COVID and the fact that we've had to hire and recruit lots of temporary workers to assist both in the health department and across the county. Unfortunately, we've had such good success. This is a horrible thing to say. We've had such good success in being able to recruit people for the health department and for those other temporary positions that it's pointed out several other large flaws in our HR process, ability to process paperwork because of COVID. So what's happened is we've been hiring those workers is getting further and further behind in paper filing, which is kind of sad to say, but is true. And what that has resulted in is times when, for example, somebody's been eligible for benefits, but the literal physical paperwork because of COVID and the fact that we have limited staff in the office and limited ability to move paper around, that paperwork isn't keeping up throughout the process and getting necessarily to, say, for example, benefits, and people aren't getting enrolled in time for those benefits. So we're able to solve those problems on the back end, and make corrections to do that, but it's really pointed out some of the huge bottlenecks we have by continuing to be a completely paper-based HR office. So as you can imagine right now, we have normally about 860 TEs in our organization. Right now, we're closer to almost 1,100 because of COVID. Yeah, and that's, backfill in a lot of departments, but a big piece of that has been the health department. So we have been talking to NeoGov with a plan for coming to the commission next year to move to their core HR platform, which includes electronic personnel files and electronic creation of all the forms that folks currently have to come into the office to fill out. And that's everything from their I-9, which verifies that you're a legal resident of the United States, and your W-4, which tells us what kind of taxes to withhold for you, and then commissioners, regular employees, it's their medical benefits form and their PERS and all of these things. And so we had planned on looking at that and bringing that to the commission in 2022. Unfortunately, we are literally buried. It ends up right now that on most Fridays we have over a foot, literal foot of paperwork that is paper that somebody has to run around and try and process. And so NeoGov has come forward, recognizing that a lot of local governments are in this spot, and agreed to waive the fee for the first year of the software if we will sign on to the core HR application in this current year. So if we, what we're asking today is for the commissioners to sign an agreement with NeoGov that would allow us to implement that core HR feature and the connection to the benefits software system that will allow us to electronically share information with benefits office. The cost of that is about $13,000 for this first year, and that is all implementation. There is no actual cost for the software. We won't actually pay anything for the software until December of next year. December of 2021 will be the first time that we have a payment for that software. So what we're doing here is asking to basically spend money that's in the existing budget for the implementation. We'll be able to pay that out of the HR budget, but this would require us to roll the HR application software into next year's budget when we will actually have a payment in December of next year. But again, this solves a huge problem that we're having, just for folks to understand what that is. Again, we've had to employ a lot of folks for that. And as we all know, in January, COVID is not going anywhere. And as we continue to see the uptick, we continue to get more and more requests to hire additional temporary staff to kind of help address these issues in the health and elsewhere around the county that are happening. And we anticipate that will continue for some time. So.
No, that's great. And for our esteemed media representatives on the line, this is government efficiency playing out before your very eyes, enhancing efficiency. So I would move that we authorize the chair to sign the NeoGov order form.
Okay, fantastic. All in favor?
Aye.
Aye. Thanks, Chris.
Thank you.
All right, some correspondence about the letter on wildfire adapted Missoula.
Yeah, this is something that we signed last week, Josh, while you were out of the office. The comment period ended on Thursday, and we had to get it out the door that day and didn't have time to get it on last week's agenda. So.
Who are we sending the letter to?
Oh, this is going to the Lolo National Forest. This is their proposed wildfire adapted Missoula project.
Okay.
And so if you get a chance, take a look. The comments in there reflect some of the discussion that we had with, say, Jack Cohen about ways to focus on the home ignition zone as being kind of the primary culprit when it comes to wildfire disaster. And it was great to hear from Adrian earlier that we're getting significant funds to put into the home ignition zones here in.
That is really great. That is really great.
Hey, while we're on the correspondence topic, I think it would fall into this category. And Jason Emery, feel free to chime in here if you want. But many of you might know that for whatever reason, whether it's the fact that I'm in your contact list or there are other gremlins in the system, when you try to send me, as in Dave Strohmeyer, an email message, it pops up. The address that pops up is my old city council address. So there's likely been any number of messages that folks have sent me that I have not responded to, not because I was attempting to blow anyone off, but it was just going to an old address. And I think as of today, the city of Missoula came up with a fix such that if you inadvertently send an email to that address, it will redirect to my county address. Is that correct, Jason?
It is, yeah. I suspect, as we've spoken in the past, that folks just have an old frequent contact saved in their mail client, because most of those clients like Outlook and such will remember addresses that you use, and that's probably the first one popping up. So, of course, be nice if folks would, watch for that so they're not inadvertently sending it to the city, but this will at least allow you to get messages that you might be missing. So it's a good interim solution.
Thanks, Jason.
Yeah, thank you. All right, on discussion items, we have number one here is budget amendment discussion.
Good morning, Commissioners. This is Amanda. We have a budget amendment for Thursday's public meeting. It is a CAPS grant. Received an additional grant from the Montana Department of Health and Human Services related to behavioral health services. That is part of a COVID-19 response package. The grant is about $130,000, and you signed the grant contract on October 8th in an administrative meeting. This is just merely to add that money and the expenditures to the budget for fiscal year 21.
Great. It's the best kind of budget amendment. Comes with its own money.
It is definitely my favorite. It's pretty clean. So I'll be presenting that on Thursday, and this is just kind of your heads up. And if you have any questions, because this one was fairly straightforward and you had already looked at the contract, I'll probably just go ahead and do it and let Aaron continue to go find us money and services for the community that day.
Great. Thank you.
Thanks.
Thank you.
All right. Anything on upcoming board meetings, review of meetings?
Tomorrow's Veterans Day.
Yay.
We will be closed for business.
All right. Any COVID-19 stuff we haven't spoken about already?
Sorry, Commissioners, it's taking me just a second here. Ellen was hoping to join us and give a little update here, but she was not available until 10:30, which is in about 6 minutes. I apologize.
Oh.
I told her 10:30 would be about the time I thought we would wrap up with admin. I don't know if Adrian has anything to update, not to put Adrian on the spot. I know she gave a quick update just a moment ago in your staff meeting, but if there was anything she had to share, otherwise I apologize. We have a couple of minutes here before Ellen's able to join us.
Yeah, a couple minute break is just fine.
No, I'll attempt to fill the void with probably nonsense, but some of the work that we've been doing directly with the health department for the last 2 weeks, Ken Parks from our office has been spending quite a bit of time over at the health department helping them kind of evaluate each of the sections to determine if they're, maximum efficiency within the incident command system, and taking a look at any potential reorganization that they may need to do. And then last week, he spent the week over there at filling in for Cindy Farr as the acting IC, and that gave him another opportunity to kind of look at where they can be most efficient with the rising case numbers, and how they can be more responsive to contact tracing and case investigation. And so I think you'll see some reorganization coming in the next week or so. I know that he's still in meetings with them this week, continuing to just refine their processes and taking a look at their organizational structure to ensure that they're kind of prepared for not only what's occurring right now, but also what we may see in the coming months.
Great. Well, I would love to take a moment break just to go get a glass of water, since it's been talking since like about 8:15. No hydration. I'll be right back, if that's okay, given we have a couple minutes till Ellen.
Yeah.
Okay.
Recess.
Has Ellen joined us?
I don't see her yet.
Okay, thanks, Annie.
I will try shooting her a text just as I know
Okay.
she was coming from another meeting, so see if
Thanks.
she's able to join. Ellen just popped into the participant list. I'm not sure. Ellen, are you there?
Yeah, I was just trying to see if the other business was conducted before I popped in.
Yes, yeah, we just finished up. I think Dave should be back here in just a second. They were running to grab coffee, I think.
Okay.
We're ready for you. How are you doing, Ellen?
I just kind of let other people tell me that.
I'm here.
But thanks for asking.
Well, I just got back from time away, and man, it's really a good thing.
Yeah.
I didn't succumb to looking at email. I was a lot of time out in the world, which was
That's what Cindy did last week. So I'm glad she took the time off, but I'm really glad she's back this week. So
yeah, sure.
Well, Ellen, I guess I'd just be interested in an overall assessment of COVID from your perspective, seeing the continual spiking of new cases and such, and what if anything we can lend by way of additional support to you and your staff.
Yeah, I'd love to hear just generally to add to this. What do you think? Why do you think we are where we are, and what can be done?
Yeah, well, we are where we are because this is what pandemics do, and I don't mean to be flippant with that at all.
Oh, I'm asking you a real question.
But this is what pandemics do. They just spread exponentially, with the exception of what controls you can exert against that spread. And our two major controls are isolating the sick and quarantining the exposed. But the priority is to isolate those that have the case because they are absolutely contagious. And all the community controls that we call non-contagion, everything from masks to social distancing to smaller groups. I mean, all of that. And, the evidence really shows that you have to use all of those. So Missoula has done that really wonderfully. We keep, for those who haven't figured out how to do that, we certainly have had all the support we need from the county attorney's office to convince them otherwise. So that's great, but the majority of people are doing that. Even with that, however, we are past the point at which the guidance, does say you will start getting into uncontrollable spread. In fact, once you get past 25 cases per 100,000, I'd say the most widely accepted guidance, which is globally accepted, the Global Health Institute, is to truly go into some sort of shutdown. So we went partial, obviously, and we could, and I think everything we've done so far helped us stay almost disease-free for a long time. We still are below our fellow counties in terms of incidence rates, but that's not a gloat or a pat on the back. That while that is we are more slowly getting to where they are. And that's really what we have to look at. So as we weigh things between what should go on and what shouldn't go on and how it should go on and so forth, we have to keep in mind that the pandemic itself will shut everything down at some point. It's going to do it through sickness. It's going to do it through quarantine, inability to operate, and so on and so forth. So if you look at the modeling, if you had no controls in place, just the hospital modeling would, I mean, they are models, but they're really fed by data, and other parts of the country have been through this before us. And they are being done by a very good epidemiological team using Montana and Missoula data and transmission rates. Our hospitalizations are going to increase significantly, or our demand, between now and maybe peaking around Christmas week. I mean, it's bad. So on the one hand, let me show you some of the indicators that kind of show you what we watch, the things we can control, and the things that tell us what it's doing, if I could.
Please.
Okay, and some of you may have heard these. I think Josh has, so just bear with me. I do continue to change them up as I get better data, as I get better understanding, and as we change our systems. So, and when you see these later today, we are trying to go public with them this week. You're going to see some different numbers than, can you see this now?
Yep.
Okay, great. Well, there you go. If I can do this, right? I can do anything. You're going to see some different numbers because Tuesday at noon is our weekly EPI meeting with University of Montana epidemiologists. And these data I put together last night, and then the cases that came in today worsened some of these numbers, okay? So don't be surprised if you see it change as soon as in the next 24 hours. I will not press the hyperlinks simply because what it's hyperlinked to is info.com website, and every Monday through Friday, usually no later than 10:30, so it's up now, you will see our daily cases, our incidents, you'll see our age breakdown, you'll see the epi curves, the charts. You know, so I'm not going to click into that, but this is what we've been watching internally and for decision making. And there's 3 types of indicators. We're ready to add a 4th one, or surveillance one, but one is what is the disease doing? And the second one is how are our resources holding up? Again, key ones, there's tons of data. And then what indicators do we have that the community is using the non-contagion, all the non-contagion options? So the epi profile is just a picture, right? It's that curve, and a perfect exponential curve it's very pretty, but it's awful. I mean, it will take out a community and a hospital and a number of people. So, you know, you've heard all about flatten, but even if you can't get it flat, you want to slow it, slow it, slow it. We are buying time. We are buying time. And there's 3 ways we're going to look at it. It's either ascending, not good, it's flattening, better, or it's descending, wow. We will get spikes. This disease spreads in a non-linear fashion. It's a distributive disease. So the key is when you get a spike, another spike on top of a growth, you want to start in the basement. You want to start in the valley. And Missoula did that. Missoula did that. When we went into the school year, we were so low that when it did start taking off, that put us way behind some of the places that had continued to take off. And it's largely all the efforts in this community, starting with you, to the businesses, to the people. I mean, you're aware of them. You're aware of them. And that made a difference. But we do continue to ascend. This column here is how are we compared to last week? And I put that in there because we've been at red now for well over a month, but we're still worse than we were last week. So our numbers continue to go up. We are not flattening. When I first started working on this, I had a hope we could flatten, but It's not happening. Our key goal indicator, even though these don't stand alone, I was encouraged to put a key indicator out to the public, which we did. And this comes from the Global Health Institute. And this is that incidence rate of 25 per 100,000 population or less. And it can be considered a tipping point. When we started working toward our restrictions, we were at 33. By the time I got them 5 days later for action, we were at 48. By the time we put them in place, we were at 51. 2 weeks later, yesterday we were at 56, but because of those catching up with the cases when the state changed its lab system Saturday night, this is actually now 61 as of this morning. So it is worse. It's better than all but one of the other county, large counties. That's not bragging, that's just saying we started from a low and that helped. Our transmission rate is an indicator of the number one means every case gives it to another person on average. It doesn't work that way, right? I mean, this is a distributive disease. One person can infect 9 and another person may infect 1. But the transmission rate as calculated using Montana evidence and Montana data is down to 1.05, and that might sound pretty good. It is yellow, but that means you're going to get at least 1.05 cases out of every case you have, and we have over 800 right now. So that's, it's good that it's not up at 1.5, but we have enough cases to work with, which simply doubling them is a problem. This indicator is actually pretty good too, and even though we do continue to lag, we have improved our contact tracing and case investigation, but we are not meeting our goals. And we have a huge migration onto another system. Thank you, Gail Hahn, if you're there, and IT for helping us. That should help. We continue to add people, but I will tell you, for the kinds of numbers that we have, if you use the workforce calculator for actually meeting goals for contact tracing, you would have to have between 400 and 500 contact tracers, which of course isn't going to happen, right? So we have extenders, we have other methods, we keep adding, we're changing systems. So we are hopeful that switching to the Cdc Sarah Alert will help us, but it's going to be a migration, and you're going to see some data disappear for a week because while we switch. So anyhow, that's where we are here. The type of spread, that's what I started talking on, sorry. Even though we have that many numbers, and you can look around at other counties and other places, we have enough contact tracing, isolation of cases being put down and contacts notified, that the really good majority of our cases are linked to another known case. So you can lag in numbers and still do a good job, but we don't want to lag in numbers either. We want to do both. But we continue to do good here, which is green. Our test positivity.
Hey, Al. So for the travel-related cases, are those originating from known close contacts while someone's traveling, or from community spread in those travel locations?
So travel is travel. So if they have a history of travel in the last 2 weeks, they're going to go down as travel. They're not going to go down as community spread or close. They're going to go.
My point is, do we have any sense of if these are travel related, whether the person who is positive has any sense of where they picked it up when they're traveling?
Sometimes, they might have gone to a family party or something, left the state and visited in Idaho. But even during the summer, this number has really stayed low. And obviously travel, when you have no cases, obviously travel will bring it into your region. But people really think it's travel and we're giving it to each other. We're giving it to the people we work with, our friends and our family, our coworkers. That's who we're giving it to, okay? Even when we're trying not to, it's a very stealthy, very efficient virus. Test positivity, we're inching up. I'm afraid we're going to get over 10, but that's still really good compared to the state, which was about 18%. North Dakota, I might add, was at 50% last week. I mean, that's what happens when you do nothing to push it down. So while I'm giving some bad news, I want to say we're still pushing down, but we are not ahead or on top of this right now. And we have been ahead or on top of it up until this point in Missoula.
Earlier you mentioned the CDC Sarah Alert. Could you kind of unpack that? I'm unfortunately unfamiliar with what that is. I
think it just got developed they've probably been working on it, but it came into use largely with the pandemic. So we had already gone on to a system before this one was known to be available to us. It's open source, so we don't pay for it. CDC and some epidemiologists and IT experts in the country developed it for this kind of use. We've been using a system that is quite good for what it was designed for, but really wasn't designed for this. So we're going to switch over to Sarah Alert, and it allows us to put, I don't want to spend too much time on it, but we could probably demo it after we get migrated onto it. But it allows us to, in an easier digital fashion, to list contacts, have them send their daily checks to us, and identify onset of symptoms, and then identify when to get them out of monitoring.
So it's software?
Oh yeah, it's an app.
Okay.
Yeah, and they can use it. They can use it either by, you've got some people that don't want to put an app on their phone or don't know how or don't have a phone. They sign up after you tell them to, and they can do it as we call them, they message us. I mean, it's going to be a lot better. However, it's not a cure-all. It's just another way in this race to try to not get, deluged, I guess. Test turnaround time, other than our rapid testing, is largely out of our control. So the numbers that I show here are actually turnaround for the PCRs that go to Helena. And they're still holding pretty good. They're not optimal, but they're still holding. But I mean, the state is roiling. When you look at the other counties, particularly the counties who have done nothing in the way of controls, there's no way we can have that kind of flooding in other counties and not us also, experience some of that. Sorry for the metaphor, but that wash over into our county.
So and you said that you don't have control on the rapid test? Is that what you said?
We do have control on the rapid test, but we don't have control on the PCR. And we are putting in for a third rapid test. Our testing is up to like 155 a day. We're going to expand into evenings and weekends. We have a 3-phase expansion going on in the next several weeks.
So can you describe how the Abbott and the PCR, how do you manage the two? What's the interplay there?
You have to be symptomatic to go on. We call it the Rabbit because it's the Abbott rapid test. But anyhow, you have to be symptomatic.
Even if someone is a close contact. If
FDA, after looking at the evidence, I think it was last week, FDA removed the approval for asymptomatic use on the Rabbit.
Can asymptomatic people get a PCR if they were a close contact?
Yeah, PCR you can do asymptomatic. Yeah.
Okay.
But I do have to tell you, as of this morning, and this is we've been sticking with the policy of offering testing to all close contacts. But right now, when you look at the numbers, there's over 4,000, and there's no way we can do all close contacts. So we are starting to look at symptomatic while someone's in quarantine, if they develop symptoms, which our monitoring will help us with, and people in sensitive occupations such as first responders, healthcare workers, detention center.
So let's say, I'm sorry to be asking so many questions. I'm just trying to make sure I get it straight in my head. So
hey, Josh, I've got to jump off for another call.
Okay.
But Ellen, is this chart available somewhere?
I'm going to make it public facing. I was hoping today, but it might be tomorrow. we've only been using it internally because we want to introduce it publicly, but I can always send it to you. Just keep in mind, it's going to change this afternoon.
Sure. Okay. Thanks. I appreciate the.
Yeah, thanks for listening.
But Ellen, if someone is asymptomatic and a close contact, they're not getting a test, do you ask them to quarantine themselves?
Yeah, they have to quarantine. I mean, they may not do it, but that's Sarah Alert will put them on our monitoring system. And then every day, as they do a symptom check, they will report in that symptom check. If they become symptomatic, they immediately move up to tier to get tested.
Right. So they're not necessarily out in the wild. They are being monitored. They're just not tested.
Exactly. Well, up until last night, they were being tested. But once you start looking at 4,000, you can't. We have to get symptomatics. It's very hard to say we're not going to do this, but we're going to, but we've had plans in place to move to priorities. And we are moving to those priorities. But whenever you do that, you leave something else out. So it's a hard switch. But this morning we did have to call it. This metric changes almost every week because this is the case investigation contact tracing system that I'm telling you we have to keep changing to improve it. The good news is we aren't, when we first got inundated with the first spike, when that transmission rate was so high, we actually lost some cases and some contacts by not getting to them in time. Not acceptable, of course. We are now getting to them a little earlier, and them is largely the ones that go into isolation, the cases who are infectious. And then the second priority are those that need to go into quarantine. And Sarah Alert will help with this, but every time we upgrade a system and add staff, keeping ahead of this virus is pretty hard. So you're going to see not only these numbers change, you're going to see this measure change, because once we get on Sarah Alert, we're going to figure out what is the best indicator to use, and we don't know that yet. So don't be surprised, but we are trying to be transparent and say, no, we're not where we should be, but we are better than we were. Hospital availability, it's either going to be open, have limited access, limited access could mean there's certain types of patients you can't take. That would be considered limited access, or they're going to be on diversion, meaning any certain type of patient can't come in. This is largely determined not by numbers of beds, this is by staff. And so when you start seeing these case counts that we are starting to see in our community this past month, that affects staff availability. So we still have limited access, but of the 10 major hospitals, 4 of them have been on red for months. I mean, and we're on yellow, and there's, I think, a couple that are on green. So this is going to continue to worsen. And then we have the average number of contacts. Some people might have 44 contacts, and we are supposed to trace them all, which, as you can imagine, is not always doable and timely. But we always watch the average, because we don't want this to, go up further. Because if you've got 4,000 or 800 cases and each has 5 contacts, you're looking at thousands of people. So this is why we like that to stay down. So that's what's going on. The other thing that's going on is I'm putting in a request for assistance to CDC. DPHHS has opened up the door. I will tell you that some of the indicators in the state clearly indicate that there should be a shutdown. I'm just saying that from the epidemiological data viewpoint. I realize there's a lot of politics, there's money issues, there's keep us, I totally get that. But the state is really roiling right now, and we're picking up speed, unfortunately, despite doing a really good job, and I say that of the community. So that's kind of where we're at. Bozeman just adopted our same restrictions that we adopted here. I will, Josh, the reason I was looking to put together a COVID committee of the health board, I think it's for Thursday, and actually Amber's going to be on this one, I want to ask that committee about taking those restrictions to the board, because they're not, I don't see them changing anytime soon, given what we have going on here. And I think that we can look at the board authority in addition to the health officer's authority, and also have deliberation with full board and public comment for something that could be lasting quite a long time. So that's kind of where I'm at. Any questions? Sorry, thanks for listening. I know it's a lot.
Anybody else have any questions? Thanks a lot for coming by, Ellen.
Hey, thank you.
Thank you so much, Ellen.
Bye-bye.
See y'all later.